And so what we're going to do is we're going to take really brief sections of feedback from each of our rapporteurs. I've told them they have around 1 minute each, so rapporteurs, you can use the mics that are there. So when I come to you, I'm going to just ask you to briefly remind us what group you're from, and then give us a really brief, succinct summary of the last 40 minutes discussion from your group. And then when we've done these 5 sets of rapporteuring, some of the people who are here are going to stay, and then a couple of extra people are going to come up, and we're going to do a really brief closing round. And at that closing round, if we're quick enough now, there'll be a brief opportunity for anyone who hasn't yet had the chance to speak, who has a burning comment that they would like to make, to do that. That will only happen if we can keep this nice and brief. So I'm gonna go from the right and move along. So Vincent, you have around 1 minute to conclude the discussions from your group. This feels like Eurovision. Give us your votes, please, France.
So it was about messages. So which messages? Use such positive messages with the community. Talk about pleasure. Say PrEP, reduce fear. PrEP is an opportunity for better health. And for policymakers, say science says it works and its cost effectiveness. How to make them, those messages? Include your audience to elaborate the messages. Show your audience you know its specificities. Talk about dark rooms. Have people share their experience. And how to spread those messages? Get your audience attention with sexy and simple messages and pictures. Use social media. Try to get free spaces in the metro, and why not give a role to play to people living with HIV in spreading the message about PrEP?
Wow, okay, nice and brief. Thank you so much. That's what we like to see. And I'm going to add one, as well as including people with HIV, let's include those of us who are using PrEP in all of that too. So on to you, great, next one. Introduce yourself, please.
Aigars, Ceplitits, Aigars, and our group was tackling the issues of cost, access, and provision. So these are the issues we were dealing with, so we should be dealing with. The first, streamlining discourse of PrEP across Europe, particularly in Eastern Europe, where discourse on PrEP is not even an issue discussed or on the radar. Second, availability of generics at affordable price. Third, stigma in healthcare systems towards MSM, transgender, migrants, and other key population. Fourth, low or lack of knowledge of PrEP in the countries in the context of migration. The fifth, access to press via different delivery channels. And the last, transparency of the pharma pricing policies and review of these policies that are tied to GDP. So what are the action lists? The action lists are first, lobbying with pharma for affordable and transparent prices in all Eastern and Central Asian countries. Do next PrEP European Summit next year. Disseminate more the discourse on pricing, best strategy, best practices, and also lessons learned and its implementation. Then PrEP in Europe should be more actively engaged with the decision makers, practitioners from the service provider setting. Advance reforming laws regulating service provisions, and the last one, mobilize international community supporting the countries with the worst situation.
Nice, thank you. A huge shopping list of things there to do from your group. Thank you so much. Max, your turn.
Yes, I was in a group talking about PrEP and minorities. I don't know what's the exact title, I'm sorry. And we actually talked about something that came up more and more, frequently, was in a perfect PrEP world, we would have stigma-free healthcare, discrimination-free healthcare. Providers would be trained in a culturally competent way, knowing about the different needs of different populations, and specifically also that the accessing healthcare is a right and not healthcare shouldn't be a privilege. And I think round about, I'll wrap it up there, shortly. I mean, those were the main points, and yeah.
Okay, thanks, Max. And Bojan, just so you know and are prepared, you will only have 1 minute to summarize. So you will have just 1 minute to be able to get, but we'll give you, Richard's going to go first, so we'll give you time to prepare. Richard, over to you.
Hello. I'm going to give you a very short feedback from the Rights and Policy Group. We have identified mostly questions that we'd like to see PrEP in Europe initiative taking forward. They would be ones about deconstructing and kicking the eligibility criteria, which end up being too exclusive and are a barrier to universal access to health treatment. And we should be looking more at who is sexually active, and PrEP should be a question about having access for those people. We should be reaching out, or PrEP in Europe initiative should be reaching out to give out more information and awareness raising on PrEP to organizations and people, using perhaps the European Testing Week that's coming up to promote messages about PrEP, for example. There are also questions of being more inclusive, be it in clinical trials or even in deconstructing the narratives around the cis white male ones around PrEP, to make it more about leaving nobody behind. And there are also questions that were raised about who can prescribe PrEP, whether it is just the HIV specialists and how we can open that up, and questions around drug advertisements in Europe and the laws that apply. Those are things that the PrEP in Europe initiative could be looking at.
Thank you, Richard. Great summaries from those four groups. So our final one, the group, now tell us in 1 minute what you'd like us to do.
Okay, well, 1 minute is actually enough, because so we are discussing in another yellow group about this structured services that would improve the impact of PrEP in HIV services. So we started quite late, and we are discussing basically from our experience. We had a lot of ideas, and what somehow came up, and I'm going to do it like really short, is basically that there's no one size fits all. Even if we have like protocols and everything of it already written, it's not only working for everyone. Actually, the important is collaboration between NGOs and clinicians, and of course, important is the task shifting, and yeah. Is there anything else? Because we're really like last minute, so if is anything I really missed from my group? Rosalind, can you help?
I am saying that as a yellow group, we failed to come up with any guidance, if you like, for what PrEP in Europe should be taking forward on structures which we discussed. So I would like to call the yellow group together again after we've all finished, and we will help Bojan, and we will promise to come back to PrEP in Europe with what our conclusions are.
Fantastic. Thank you, Rosalind. So a big round of applause for that group. So thank you to our facilitators for doing a great job. Thank you for keeping on time. Please keep these sheets of paper, and we will circulate these after the meeting.